Hi everyone, my name's Emma and I'm going to be talking about pressure ulcers, specifically those in adults in ICU and critical care settings. So first I'm going to talk about the definition of pressure ulcers, and it's defined in our Lewis's Medical Surgical Nursing Handbook as localized damage to the skin and or underlying soft tissue. They usually occur over bony prominences and can be related to a medical device. I'm also going to show you, so this is an image in the Lewis's Medical Surgical Nursing Handbook, and it shows the different stages of pressure ulcers, starting with stage 1, stage 2, 3, 4, unstageable, and deep tissue injury. So pressure ulcer injuries are crucial to nursing practice, especially in adults who are in critical care settings. It's been identified that 13% of patients in ICUs with fewer than 100 beds develop pressure ulcer injuries. And there's also an estimated range of 3 to 39% of ICU patients that develop a pressure ulcer in general. So it's a very prevalent issue, and some of the complications can include increased risk of infection, in-hospital malnutrition, increased length of stay, increased workload for nursing staff, as well as increased healthcare costs. So the purpose of this presentation is to discuss the nursing evidence related to pressure ulcer development and to also elaborate on nursing care implementations that can improve patient outcomes and lower the prevalence of these hospital-acquired injuries. As aspiring nurses, I feel like it's really important that we understand this topic because it will be a prevalent issue for many future patients that we encounter. So some of the common interventions are use of the Braden scale, repositioning, fluid and nutrition supplementation, smoking cessation, patient education, and maintaining the head of the bed no greater than 30 degrees. Some of the benefits of these interventions include for early mobilization and repositioning, it can be a reduced risk of shearing and friction factors. Alternative pressure ulcer risk scales can also increase the accuracy of pressure ulcer risk assessment, and these are scales outside of the commonly used Braden scale. Increased interprofessional and patient education can increase awareness of pressure ulcer risk factors. Increased nutritional support also promotes skin growth and can be a very efficient healing factor. Interprofessional collaboration can increase quality of patient care as well as wound management. So, summary of the evidence. These are the methods that were utilized. The first study is of 333 critical care nurses, and it includes their responses to a 5-point scale response system. The questions were related to demographics, beliefs and perceptions, and also risk factors for the development of unavoidable pressure ulcers. The next study of 468 adult patients was obtained through their medical records and also nursing reports, and they used 2 forms to collect this data. Then there was a study of 335 adult patients who were in the ICU for longer than 24 hours, and they were distributed between 5 nurses, and these patients were observed daily for their nutritional state, length of stay, serum albumin levels, comorbidities, diagnosis on admission, fecal incontinence, and other factors. The last study of 165 adult participants who developed hospital-acquired pressure injuries was across 6 different hospitals. And this was a research model, and it focused on the factors of emergent epidemiological evidence, risk-based intervention strategies, and guidance for determining whether they were unavoidable or avoidable injuries. The first study of 333 nurses and their responses included that 94% of them stated all critical care patients were at risk for pressure ulcers. Also, stage 3, 4, unstageable and deep tissue were among the least common injuries. And the common risk factors were immobility, spinal cord injury, unstable pelvic fracture, impaired tissue oxygenation, and impaired tissue perfusion. The next study of 468 patients included that stage 1 and 2 were the most common. Also, the sacrum, heel, and back were the most prevalent anatomical pressure ulcer locations. The model identified that age, fecal incontinence, Braden scale, and diastolic blood pressure were essential risk factors. The next study of 335 patients identified 88 potential risk factors, and it showed that only 37% of these proved to be significant indicators of the study. The risk for developing pressure ulcers were decreased with prolonged immobilization. So the patients were 0.58 times less likely per day to develop a pressure injury. And most were developed in the first 14 days of ICU admission. The last study of 165 adult participants also showed that 60% of these injuries were avoidable and 41 were perceived as unavoidable. Most of them were located on the sacrum area and were classified as deep tissue pressure injuries, stage 2 and unstageable. So some of the implications for nursing suggest that there were very important interventions, including early mobilization and repositioning, postural changes every 2 hours, checking common pressure ulcer anatomical locations frequently, such as the sacrum area and the back, recognizing the risk factors associated with pressure ulcer appearances upon patient admission, and prioritizing pressure injury prevention documentation. It's really important that the nurses accurately document this and do so daily. Collaborative care, incorporate increased nutritional supplementation. So in conclusion, the research supports pressure ulcer interventions. Although the study did have some limitations, most of the studies were limited due to a lack of generalizability due to single study sites, and there was a heavy reliance on accurate documentation. But otherwise, it did show that nursing education currently it incorporates the use of the Braden scale, but 2 research articles concluded that alternative measurement methods were more accurate and overall more beneficial for the patient. So it was determined that the Braden scale overpredicted fall risks, so it may be beneficial to develop alternative scales and models in the future. So overall, this evidence has strengthened my own understanding of the nurse responsibility, and I plan on incorporating the research findings into my care in the future, and I encourage my peers to do the same. So the current practice in education should continue to enforce prevention strategies as well as incorporate alternative pressure ulcer risk assessment scales. Thank you so much for listening. That's all. And here are my references.